Hi, I'm Dr. Daniel Becker, and I am a facial plastic and reconstructive surgeon, a rhinoplasty specialist. This is my video blog. I get a lot of emails from patients and prospective patients with questions on rhinoplasty, and one very common one is, Dr. Becker, how do you fix a droopy nose? It's a good question. There are a lot of ways to fix it, and a lot of it depends upon the reason why it's droopy. One technique is to reposition the tip. When people talk about a droopy nose, mostly they're talking about how the tip hangs too low, it's drooping. And so what we can do is reposition the nasal tip and lift it up. Sometimes that can happen just by restitching the tip cartilages to the septum. The septum is the wall that divides the nose down the middle, and that is one very effective way. Also, we can reorient the tip and use suture techniques to reposition the tip in the upward direction. One big question related to this is, how do you know how far to lift the tip? Well, we decide that with you in the office using computer imaging. So we don't make it up ourselves. We work with you to decide on what's the right amount of lifting of a droopy tip for you. Sometimes we'll actually cut the cartilage to allow it to reorient and then suture it back together in such a way that it will lift. Here also is an example or two of patients who had droopy noses that were successfully lifted using these and some other techniques. You often need to use more than one technique. Of course, each patient is different, and so I would need to see you in the office to review exactly which techniques we'd use on you. But I hope this gives you some sort of general idea of the kinds of things that are required. The recovery from this sort of surgery is uneventful. It usually takes about a week. We take the bandage off, and patients are presentable to the public in 7 to 10 days. Please explore my website, therhinoplastycenter.com. We have answers to these and so many other questions on this website, and after you've done so, please feel free to send me an email question. I'd be happy to respond, and you can include pictures if you'd like. I look forward to hearing from you.